And we're back, and we're moving into our second conversation for this morning. Of course, while we talk about the COVID pandemic, there are specific vulnerable groups oftentimes that we hear about that still require additional care and additional services. And so today, we're going to be focusing on the situation of HIV/AIDS in Belize and in the region. And this is in anticipation of World AIDS Day tomorrow. Joining us for this conversation, we have the Executive Director of the Caribbean Vulnerable Communities Coalition, based in Kingston. We have Ivan Cruickshank. Good morning.
Good morning, Ivan.
Hi, good morning to you both. How are you doing?
We are good. We're good. How's the weather in Kingston?
It's brilliant here.
Yeah?
Nice sunny morning.
Okay, fantastic. Ivan, this is perhaps I think something that has happened over the course of this year is that we've not been talking to partners as much about the situation of some of our vulnerable populations. And our HIV population is definitely not just at risk for COVID, but of course at risk for several other things as well. What has the response been across the Caribbean?
Yes, the response has been one of, it's mixed. Because one of the things that we have seen is that a lot of resources that were normally, focused on the HIV response has had to be moved to the COVID response, and so that has posed a challenge for us. But at the same time, what you have found is that you have seen, particularly civil society, working with national AIDS programs, stepping up to try and fill that void and address some of those gaps that have emerged. So that's the big challenge. And we also have our international partners who have come on board, who have recognized the need for us to scale up our interventions for HIV in the context of COVID. So that has been the response that we have had so far across the region.
Now, there's certain things we've missed. We missed the mid-year regional testing day, and tomorrow is usually another big testing day. And it's a great marker as the years go by to see how we are doing. Have people been getting tested for HIV? Because I feel like we've only been talking about COVID tests.
Yes. So, we have had a significant scale back in our outreach interventions. And that is largely due to the fact that we're trying to manage the crowds of people. What we have sought to do is to move some of these interventions online. Okay. Where we have put online opportunities for people to reach out to whether it is a civil society organization, a national AIDS program, to say, I'd like to get tested and make the necessary arrangement. The challenge with that approach is that it is demand driven. So whereas our national testing day and, you go out into communities and people who would not think that they need a test would see you out there and would come and would get a test.
Yeah.
Now it is somebody who actually deliberately wants a test, who then have to pick up the phone and call or go online and then engage with you to say, I'd like to get a test. Can I get a test? The screening is perhaps done online, and then the appointment is made for you to come into a facility to get tested. We have started, however, to move back slightly in some of the countries into doing our outreach testing, but on a much smaller scale to control for those numbers.
Yeah. Let's step back a bit. CVC is a coalition, and you work across the region. Tell us about the partners that you have on board, both within Belize and throughout the Caribbean, and how you work collectively in being able to advance the goal of reducing HIV in the Caribbean. Okay.
So, as you said, we are a coalition of NGOs that are working in the HIV field. So you have, we work from the north right down into the south, right down onto the Guyana. We are in Trinidad, organizations in Trinidad. We work in the French, in all the 4 language areas of the Caribbean, and of course we are in Belize, which is in the central part of the region. We also work with PANCAP, so we're a critical partner in PANCAP, That's the Pan-Caribbean Partnership on HIV and AIDS. And we work closely with UNAIDS, both at the regional level and in country. So we do work with them to provide the community approach and the community type interventions to the response in the region. In Belize, we are very fortunate to have some good partners. We work very closely with the National AIDS Commission there in Belize, and we have a number of civil society organizations in Belize that we collaborate with, including organizations like the BFLA. We work with EYBM. We work with Our Circle. We work with PETAL, a number of organizations in Belize that we do work with to try and address the issues around HIV and AIDS, particularly around the most vulnerable populations.
So while we've identified that quite a number of resources have been reallocated to the fight against COVID-19 that have been taken away from the HIV/AIDS response, what is the new approach now in terms of being able to provide continuous, in terms of addressing the issue now that you have resources being taken away from this particular effort?
Yeah, so there are two things that have happened. One is that, some of our global partners have actually put in some additional resources for us to sort of rethink our efforts, to redesign our programs, to identify additional resources that we can bring on stream. But one of the critical set of interventions that we have been pursuing is moving to some things that we should have done for a long time. When we think about things like telemedicine, which we have not really been embracing, we have had to move more aggressively towards the use of telemedicine. So you have somebody who is living with HIV who every month had to go to their healthcare facility to engage with their healthcare provider. They can now use telemedicine to engage with their healthcare provider, to make sure that they're checking in. We do online support groups as one of the responses. We're actually trying to move to do self-testing, which is not very popular in the region, but something that we're trying to push and promote so that you don't have to wait on an outreach intervention. What we want to ensure is that you have access to the facilities to be able to do a self-test. So we are shifting gear and moving to provide services in ways that allow for us to continue providing the services even when we have to divert resources to the COVID response. And that has been a challenge because, it's a new environment, it's a new context, and so we're learning how to manage some of these things. But so the uptake of, for example, self-testing has not been very high because most people are still not prepared to be able to do a test at home and then manage that. You still need to do your counseling, and they want to make sure that there's somebody who they can connect with. And you also want to make sure that once people test, if they test positive, that they have the right information about what they do after they test positive. So that is still a work in progress.
There's even contact tracing that happens with HIV. I don't think people know that.
Yes, and then you then have to make contact with your healthcare provider, who would then trigger the contact tracing. The other thing that we have been able to do is to move towards things like multimodal prescription. So instead of you getting your prescription every month, we now do multimode prescripting, where we give you based on your situation, because it's managed by the individuals at individual level, based on how you're managing your illness. So somebody who is managing their illness very well, you may find that the doctor prescribes 6 months of medication, and provided the health facility can give you those 6 months of medication, you get your 6 months of medication, and then you only have to do occasional check-in with your medical practitioner. So we're looking at different approaches that can help us to continue to provide services in the context of diverted resources to the COVID response.
Yeah. And what about looking at some of the other issues about being able to access services? We've heard and we know that the HIV population, those who are living with HIV, are also most at risk for severe forms of COVID because of the body's immune system. Have you found any challenges or have there been any reports of challenges in accessing services? And how do you provide emotional support for people? Because being a high-risk group is extremely, it takes an emotional toll.
Yes. So, yes, that's a very important issue. You know, because of your immunocompromised system, that you are more susceptible to a more aggressive form of COVID. And so that's something that we are very mindful of. And we have been working with our healthcare providers and partners to do two things. One is to ensure that people get on treatment. So the issue is that a lot of people who are HIV positive were not on treatment or are not in care. And so we have been pushing a lot of what we call come to care or back to care campaigns across the region to find people who are HIV positive, to ensure that they come into treatment, they get on treatment, and that they get the support that is needed that can assist them in a time like COVID, such that if they should contract COVID, their immune system would have been improved somewhat. So that's a big issue for us. The second thing that what we have tried to do is we have tried to put in a lot more psychosocial support programs for people living with HIV, because we have found that there's a lot of anxiety among people living with HIV because of the immunocompromised situation. We have found that people have just really been extremely fearful, extremely cautious. And it's a good and a bad thing, because for those who have not been on treatment, what we have found is that a lot more people are now coming towards treatment and saying, we want to get on treatment because we don't want to get, affected by COVID. But the flip side of that is that it creates a lot of anxiety in people, and therefore you have to then assist them in managing that anxiety. We really don't have a lot of psychosocial support in the system already. Yeah. So we don't have a lot of counselors, we don't have a lot of psychologists in the system. And so that there's a great need for us to scale up the numbers of social workers and psychologists and psychotherapists who are involved in the HIV response across the region.
How do you keep the conversation going about HIV? The Caribbean, for a very long time in the past, held a distinction of having a high number of new infections. We started to do better. I think it was 3-4 years ago, we noted that once again, our new infection rate was increasing. So we know that it's still a very pertinent issue for us here in the Caribbean, where other regions have been able to get it under control. How do you keep the conversation going when clearly our health priorities and the capacity for attention is all geared towards something else at the moment?
Yes, you are so correct. We continue to be the region with the second highest prevalence of or incidence of HIV globally. And that's something that we really have to try and see, how do we change that dynamic? And COVID has not helped, because what you have found is that we have not been able to give the dedicated attention to prevention conversations that we would have liked. We just as we started to look at rethinking prevention, COVID came. And so we had to divert our attention. So it is a challenge to maintain the conversation around HIV prevention when you're talking about COVID prevention. But I think COVID does provide us with what I want to call a golden opportunity, because a number of the interventions that we have known to have worked in HIV over these many years are now being practiced in COVID, and in fact being scaled up in COVID. And so
Like what?
So if you think about something like contact tracing, which has been a part of the HIV response and not very well known, contact tracing, now everybody knows about contact tracing for COVID.
That's true.
And so when people do contact tracing for COVID, it's not a big issue. But when we have to do contact tracing for HIV, then it poses a challenge. And so I think COVID does provide us an opportunity for people to normalize things like contact tracing and engaging around a specific set of issues. The second thing that we have seen that COVID has provided an opportunity, and perhaps not only for the region, but globally, is the pace at which we move towards finding treatment for the response. If you notice how fast we have been able to move to a vaccine for COVID, and in the case of HIV, we have been trying to get to a vaccine for the last 20, 30 years, and we have not yet gotten one. So I think COVID has taught us that you can do it. You can get there if you want to.
That's an interesting point you raised there, because I thought of the same thing as well, where the race to find a vaccine for COVID versus the race to find a vaccine for HIV has been completely disparate, so to speak, in terms of the lopsidedness in that particular effort.
So I think the issue has been how HIV had actually started. So HIV started out early, and it was initially seen as a disease that affects just a particular group of individuals.
Yeah.
There's a high level of stigma around it, and I don't think that the level of investment and commitment at country level, at global level, that was required to really move us towards finding a cure for HIV or a vaccine for HIV had moved apace on, as we have seen in the case of COVID. What I think is important moving forward is to note that we have to address the issue of stigma and discrimination.
That's right.
Across the region, stigma and discrimination continue to be the most significant issue that faces the HIV response. It affects people's ability to come in for testing. It affects people's willingness, once they have been tested for HIV and found to be positive, to come into care and maintain their care, because they don't want people to know that they're HIV positive and see them go into a clinic that is an HIV clinic.
Yeah.
And family, they don't want their family to be aware of their HIV status. So therefore, the support mechanism that is critical to ensuring that people remain undetectable, even where they're HIV positive, is not in place, because you don't want to tell your friends and your family about your HIV status. And the implications of that is that you continue to operate as if you are not HIV positive. You are scared to have protected sex because you don't want people to call you out and say, but why you want to use it? Why is it so important to you? Exactly. Yeah. And so we do have the numbers continuing to rise. So these are issues that we have to grapple with in a serious way if we are going to get a handle on the HIV epidemic. We really have to pay attention to stigma and discrimination and bring on board all of the partners to address stigma and discrimination.
And on the issue of stigma and discrimination, how important is it that you have the up-to-date reports of human rights violations that take place as a result of stigma and discrimination from HIV? We know of stories where people are ostracized from their families. We know people lose their jobs. We know that there are many stories that we hear. And I know CVC works on being able to put together an adequate database. Was it last year or earlier this year?
So.
The Equal Opportunities Bill in Belize, which was headed by the National AIDS Commission, was squashed. And it was a very important opportunity to be able to ensure that we could minimize the level of discrimination that people with HIV were facing.
Yes. Yeah, so we continue to see we continue to get the stories, and these are not just anecdotal. This is evidence collected from individuals who have been affected by HIV discrimination and stigma across the region. People being, continued unemployment, people being put out of employment because their boss have identified that they are HIV positive. Families neglecting their loved ones because they have been diagnosed HIV positive. We even have issues around violence being perpetrated against people, particularly women who may be in a relationship and their partner find out that they are HIV positive. So these are things that continue to haunt us as a region, and issues that are being reported to us at CVC. We're capturing those in our human rights database, and we do have reports from the different countries about what the level of violence and violations are on these particular issues. But for me, addressing those issues will be critical to ensuring that we actually get a handle on the HIV epidemic in the region.
And I guess that feeds right into the theme for this year's World AIDS Day.
Yes.
Yeah, tell us about it.
So the theme for this year, this World AIDS Day, is Global Solidarity, Shared Responsibility. And I like to sort of shift it around a little bit when I talk about it, to say you really need to start with the shared responsibility. What do we want when we talk about shared responsibility? We start at the individual level. You as an individual, you have a responsibility to protect yourself and to protect those who you engage with sexually around HIV, to ensure that you don't, if you're HIV positive, you don't pass it on to somebody. But if you're not HIV positive, that you protect yourself and you do the things that are necessary to ensure that you stay negative. At the community level, I think we have a shared responsibility at the community level as members of a community, including the family, to provide support to people living with HIV. So if there are people living in your community or in your family who are HIV positive, we have a responsibility to provide as much love, support, care, and help them to build their own resilience to manage the disease that they have. So I think at that level, it's very, very important. What else can we do at the community level? We can start the conversations around addressing stigma and discrimination, whether it is in the church. So we do have churches, and churches are places where people, gather. At the church as part of the community can take the responsibility to lead the conversation, to not, make statements of, reflecting bigotry from the pulpit. So those are things that can be done at the community level to really demonstrate the shared responsibility. Yeah. At the national level, I think governments have a responsibility to be able to ensure that they are reaching people who need care, reaching people who are HIV positive, and providing the requisite care and support that is needed to all who need it, notwithstanding their own national positions on some of these issues, because we're talking about the health of individuals here. Okay. And so, you talked earlier on about the equal opportunities bill that was there. How are we at the national level going to take responsibility for ensuring that we protect people against discrimination? And one way that the state can do that is by putting in measures to ensure that people cannot discriminate against people living with HIV willy-nilly without some consequence. That's a responsibility that the state has. The state also has a responsibility to ensure that people have access to timely treatment, care, and support. And it should be at affordable rates. In some instances, we think that it should be free. But if it can't be, it should be affordable, which means that putting services where people can reach them and they don't have to drive, let us say, from Belmopan to Belize City to come to a health facility. That is just not putting the service in an accessible way. So how do you ensure that services are where people need them?
Yeah.
That's a part of the responsibility that governments have. And the level of global solidarity now, we're talking about how do we ensure that our international partners bring to bear resources and technical expertise that can help countries to, manage their epidemics. That's very, very important, because oftentimes what we find is that countries want to do things, but they don't have the resources. And this is where our global partners can come on board, provide support, whether it is financial or technical support, to ensure that countries can actually scale up their HIV responses. So that's just the sort of circle of global solidarity, shared responsibility that we are talking about
from an individual level to putting it in context of all countries across the globe assisting in support. Ivan, how do you, I can't help but sit here and think there was a time where we talked a lot about HIV and HIV prevention and services that are needed. And, I think as the situation seems to have gotten better, we talked about it less. But knowing that up until last year, we were still seeing Belize, especially in the Caribbean, was one of the countries with the highest new infections.
Yes.
That HIV is actually one of the top 10 causes of death in Belize for the past few years. There are about 100 people that die from HIV each year.
Yes.
And it is not a deadly disease as people call it anymore. There is medication available. There are tests available. There are monitoring tests to see your viral load so you can get it down to being undetectable. So clearly, we have a lot of work to do here in Belize. How do you, what's your message? What's the area that concerns you the most? I know you have the regional perspective, but if you were to put your finger on perhaps priority areas or actions that your partners in Belize would really want to see addressed so we don't have this situation, what would it be?
So I'd say, I agree with you that, and it's not only in Belize, I think across the region we still have too many deaths. So across the region we had 6,900 deaths last year alone, which is unacceptable. It should, that's the estimate. We shouldn't have so many people die. We had 960 new infections among people 0 to 14, which means that through prevention, through mother-to-child transmission programs which are not working effectively, or young people who were not providing services to acquiring the disease, it's a big issue. And we had 13,000 new infections overall across the Caribbean. So there are things that we are not doing right. So if I was to identify some things that we need to focus on, is that one, we need to make sure that we are providing accurate messaging to our young people.
Yeah.
We shouldn't be telling our young people about abstinence only. We should be able to say to our young people, abstinence is a preferred choice, but if you have to have sex, use a condom consistently all the time with whoever you are engaging with. Yeah. We also need to be talking about the issue around partners. It's a big issue across the region, multiple partners. We really have to begin to talk to people about how do we, identify one consistent sex partner, and also having this conversation about our HIV status. That's something that we don't do. We really don't have conversations about sex and what happens with sex. I think it's something that is taboo, and we have to get around that. We have to recognize that HIV is with us, has been with us for a while. It's transmitted via sexual intercourse, and we have to have frank conversations about that and the implications.
So the 0 to 14 age group, it wasn't just mother-to-child transmission. Some of these were sexually acquired infections.
Exactly. So it's not just only mother to child. It's because we have been doing in a number of the countries, we have actually moved to elimination through the mother to child program, which seems to me to suggest that we do have a number of persons within that adolescent age group who have acquired HIV through sexual contact.
Yeah.
And that's an issue that we have to confront. So we have to not be afraid to do our health and family life education programs, our sexual health programs in the schools, and engaging in ways that allow us to be able to have the conversation with the youngsters the way they are having it and their way they are accessing it online and in other spaces.
Well, I think, and this can perhaps be one of the final points, I don't know what the laws are like in other parts of the Caribbean, but that particular age group, if it is a sexually acquired infection, that's sexual violence because there's no consent allowed for at that age. So it's very important, and I think it's interesting too to see how even organizations or coalitions like CVC have expanded to look at how gender-based violence has a role in the spread of HIV as well.
GBV is a significant issue in the spread of HIV. We have found, and in a lot of our work that we have been doing, we have actually recognized that without addressing gender-based violence, you cannot address the issue of HIV. The two things are linked because we have seen that in a number of the cases, the power dynamic that exists between male and female, with older men and younger women, those power dynamics, the power dynamics that have been driven by just how people have resources and not have resources, those issues determine whether people can actually negotiate condom use. And they contribute to gender-based violence in serious ways, where a woman would say, I'm not going to have sex with you without a condom, and then the man becomes violent. And so she no longer makes those demands because she's fearful of gender-based violence. And so we have to continue to address the issue around gender-based violence in very serious ways if we are going to tackle in a significant way the issue around HIV across the Caribbean. And the issue around just our patriarchal nature and the way that men view themselves and our hypermasculinity across the region is something that we have to address. To not be hypermasculine is a sign of weakness. And so men demonstrate their masculinity by violence towards women. And in that situation of violence towards women, sometimes what you find is that a sex act is perpetrated, and that sex act is without condom. There's no conversation. There's no negotiation. The woman is not protected, and the possibility for transfer of HIV occurs. And so that's a big issue that we have to grapple with as we move forward in the response.
All right. Well, we hope that today's conversation and, of course, the commemoration of World AIDS Day tomorrow will bring back into focus the situation of HIV in Belize and across the region, and that we are reminded once again of our individual roles and the collective roles of our community in getting the number of HIV cases reduced. Thank you, Ivan, for joining us.
Oh, you're welcome. I'm happy to join you anytime. All right. Have a nice day. Good.
You too, and stay safe.
All right. Bye-bye. Good.
And with that, we're going to go ahead and take our final break. And when we come back, we'll have our wrap-up. So stay tuned.